The citizens of many countries have long traveled to other countries for the expertise and advanced technology available in leading medical centers. In recent times, a new trend has emerged known as medical tourism. This is a situation wherein people from less developed countries travel to other developed countries to receive medical care and a whole variety of medical services available to them. But the big question is, what are the resultant effects of this medical tourists going to other countries? That is why today on INDEPTH, our spotlight will be on medical tourism. And of course, we have a guest in the house, a medical doctor. Yes, but I'm going to be introducing him to you after this timeout. Don't go away. My name is Priska Wankwo. This is INDEPTH. Hello and welcome back to the program INDEPTH on ABS television. Just before the break, I told you that we'll be having a medical practitioner in the house. You know, we are talking about something relating to the medical field. We're talking about medical tourism. Every day, millions of Nigerians travel to other countries to seek medical care. And one would wonder, what is happening? What is happening to our healthcare system? Is it that we don't believe in the quality of the services that our healthcare system has to offer us that make us every day to become tourists in foreign countries? That is why today on the program INDEPTH, I have Dr. Obinna Aniaboso. Dr. Obinna Aniaboso is the president of the Association of Resident Doctors, Chukwemeka Odumegwu Juku University Teaching Hospital, Amako, Oka. Hello, Doc, and welcome to the program.
Thanks for having me.
Yes, I know this is your field, you know, medical tourism. When you talk about medicine, you're talking about doctors. Okay. So I would like to know from you, Doc, what is this medical tourism? What is medical tourism? What's the trend all about?
Okay, first of all, in simple terms, I'd like to define medical tourism as the movement of individuals from one country to another in search of medical treatment, medical therapy. Okay. So, of course, most times the trend is from developing countries. Okay. Most time people move from developing countries to developed countries, of course, in search of this medical therapy. Of course, in Nigeria, unfortunately, happens to rank among the country that actually spends the most medical tourism or engages in medical tourism the most. Okay. And the trend has not really abated. I think it has actually been on the increase.
Right. So you said Nigeria is one of the countries that is being ranked high when it comes to medical tourism. Why is this ranking high? Why is Nigeria on the scale? Don't we have medical facilities here?
I think the causes are multifactorial. A lot of, but I think I'm going to put the blame straight up at on the foot of the government. Understand? So I think the chief reason being the poor funding of the health sector. You understand? Over the years. You understand? So, for instance, there's an Abuja declaration in 2001. So Nigeria with other African countries in Abuja pledged to allocate at least 15% of its yearly budget to the health sector. But unfortunately, that has never happened. I think the highest we've allocated over the years was just in 2012 when about 6% was allocated. This year alone, we had 3.9%, so we're coming down. So I think it's the poor funding of the of the health sector that is the chief reason for medical tourism over the years.
Right. So apart from the government, are there no other reasons why people decide to, move to other countries just to receive medical care? Okay.
Apart from that, of course, for some reason, there's this low confidence that our people have for the doctors in Nigeria and, of course, the medical facilities in Nigeria, and which I would say is misplaced. Because globally, I think Nigerian doctors, they rank very high, you understand? You find our doctors everywhere in the US, in the most advanced countries, doing very well. We have up to 26,000 Nigerian trained doctors practicing in the US. We have over 5,000 practicing in the UK and rising. If you go to Dubai, Saudi Arabia, you see our people there. So, unfortunately, funny enough, when these politicians and Nigerian elites go outside for medical tourism, they are still treated by the same Nigerian doctor. So, but I think that what has conspired to make us look bad, per se, it's because of the poor facilities, the poor working conditions. You understand that? Because if we had access to the facilities that these people have, of course, the outcome, the output from doctors would be very high. But of course, because of the poor facilities, for instance, if a patient comes to the hospital, maybe needs a CT scan, maybe a patient that has a stroke. Of course, to get a CT scan, that's like 45,000, and the average patient cannot maybe afford that. And maybe you need it within 3 hours, to determine your intervention. In some cases, they will tell you, doctor, wait, let's go and look for money. You understand? So a lot of times we have to depend on, our thinking faculties, our clinical diagnosis. So sometimes the delivery outcome is not as much as.
Okay, all right. In recent times, middle-income countries like India, South Africa, and a whole lot of other countries are gradually becoming tourist destination sites for people seeking for medical care. That is, if somebody has a problem, the person is referred to a hospital in India or South Africa or somewhere. So why is it that those countries that previously were seen as nothing, as developing countries, are now taking over when it comes to proper medical care? What is it that are doing different that we are not doing?
Okay, that's a good question. I think the key difference is that these countries had visionary leaders who had foresight, you understand, and of course had developed a strategy at the time to make their countries medical tourist destinations. For instance, Dubai today is doing very well. 10 years ago, I read somewhere that in the 1950s and 60s that Saudi royals used to come to Nigeria, the University College Hospital in Ibadan, for medical treatment. You understand? But over the years, because of the vision of their leaders, you understand, they've been able to transform their countries from, medically deprived countries to viable medical tourist destinations, and they actually reaping the fruits. If you go to Dubai, has a strategic a plan, Vision 2016 to 2021, which they put in place, and they also corroborated with the advanced countries that had the health technologies, the US and UK. So some of them came in, set up the health facilities there. There's American Hospital Dubai today. One is one of the big attractions for medical tourists. So if you go there, you find a lot of Nigerians there. There's the King College Hospital Dubai. So and of course India, that's also one big destination for our people, those who go for renal transplant, and all that. So I think it's the foresight of the leaders.
There's been some stories based on some research that some people have conducted, and they said that some medical practitioners actually encourage medical tourism. So, as a medical practitioner, what's your take on this?
Okay, what I think leads to that sometimes, I'm sure it does happen in some cases, but because of, the state of our facilities and maybe the fact that we are not so advanced technologically, so some doctors, who feel that patients who need certain therapies that are not available in Nigeria, you understand, maybe for that reason sometimes, of course, they refer patients outside, and if that is not really so bad. For instance, people who go for bone marrow transplant and maybe maybe renal transplant, the availability is not so much, IVF and all that, you understand, and so that is the main reason why it's done. Of course, that is not really out. Maybe some medical practitioners, maybe who do that for personal gains, those who have partnerships with doctors outside and hospitals outside, so they could also do that for medical gain, whereby they get a cut.
What about, is it not against the ethics of your profession? Doctors like yourself encouraging their patients to go out of the country, to travel out of the country to receive medical care. Is it a matter of ethics? Is it ethical for your profession, to your profession?
No, I'd say it's unethical, actually, if that happens, if anyone engages in that. Of course, it's unethical. And I wouldn't encourage that.
Or is there a penalty for that?
Of course.
Is there a sanction?
Of course, there would be.
Do you mind telling us the sanction?
It's not up to me to. That'll be the Medical and Dental Council
All right, but
determine that.
the fact is there is actually some kind of sanction against doctors that encourage their patients to travel out to receive medical care.
Definitely.
All right, we're still speaking with Dr. Obinna Aniaboso. He's the president of the Association of Resident Doctors of Chukwemeka Odumegwu Ojukwu University Teaching Hospital, Amako, Oka. Yeah, so we're speaking with him. He's talking to us about medical tourism and how does it affect the healthcare development in our society. We're going to go on a quick break, and when we come back, the program continues. This is still In Depth. You're welcome back to the program. In case you're just joining us, this is In Depth on ABS Television, and just before the break, we were talking about medical tourism and how ethical is it for medical practitioners to encourage their patients to travel out of the country to receive medical care. All right, so back to you, Dr. Obinna Aniaboso. You know, a lot of people put the blame on the government and all that, but do you also think that people also actually play some kind of role, you know, like for instance, pregnant women? They want to, you know, I want my child to be a citizen, the excitement, the pride of knowing that you give birth to an American citizen in a foreign country. Don't you also think that sometimes it's not also the fault of the healthcare system? People just want to become tourists in other countries to receive medical care?
Of course, in some cases, you find that medical tourism, maybe it's a form of status symbol among the elites, you know, and the rich class. So definitely, sometimes the attraction among pregnant women, it's the visa. They hope that when they give birth in developed countries, of course, their children could also be citizens and derive all the benefits of citizenship. We could also indirectly link that to the government, because, I mean, if we had attained our potential as a country and we would make this country attractive, then there would be no reason for people to
be going.
Of course.
Okay. You know, sometimes a lot of people say that the reason why they try to go to these countries is because medical care in those countries are subsidized. But you find out that a lot of those countries are expensive. For instance, a kidney transplant, you know how much that costs. And how can you reconcile these two extremes, saying that there is subsidized healthcare costs, and on one hand, you want to go for a surgery, you're hearing 25 million, 9 million, and a lot of other things. So how can you reconcile those two opposing theories?
Well, I do not think people will go travel out because for subsidized care. I mean, even maybe some time ago, because in the UK...
What about medical insurance? Because I'm under the impression that medical insurance helps the bills when it comes to medical. If you have insurance, if you have medical insurance, it helps you in terms of bills and all that.
Okay, is it if you have medical insurance that will recover your care outside?
Yes,
okay. Yeah. Well, if your medical insurance can also cover your care outside, it has to be actually a costly medical insurance. You understand? It wouldn't be of course, the one we have here, the NHIS, and of course the state health insurance scheme that is coming up to be so. A medical insurance that will take care of your treatment outside will also be pricey. Sometime, like I was saying, some time ago, maybe in the UK, because they practice socialized healthcare through the NHIS, there was a time it was possible for our people to go there and have access to the subsidized healthcare. But then with time, when they realized that there was an influx of people from Africa and all that, they cut that off. So people who go out there, of course, they still pay through the nose to do that. Some of them, even the people who are not so, maybe some have to sell their land, some have to depend on contributions from well-wishers and, you know, relatives.
Okay. All right. So are there risk factors associated with this medical tourism? Is there some kind of risks? All of them, as in all this healthcare that people go to seek for in foreign countries, are they always successful?
Of course, they're not always successful. Remember the case of our former First Lady, of course, who went... traveled to Germany, I think, for a cosmetic procedure, and what happened afterwards. So, of course, there's a big risk, in fact, because most times the medical facilities that we visit abroad, most time we don't know about it and we cannot hold them accountable. Sometimes the doctors are not even as good as what we have here, you understand, but because they're out there. So, of course, you expose yourself to the risk of, you know, having a botched procedure, you know, developing complications. And of course, it's not going to be easy for you to hold the doctors out there accountable, compared to, having a problem here. Of course, the regulatory agencies, and you know how you can seek redress.
Okay.
So a lot of times, you travel out there without even knowing maybe the rating of the facilities you're going for. So you expose yourself to complications.
All right. So So we've already established the fact that people go to other countries to seek medical care, become tourists in other countries due to a lot of reasons. For instance, poor healthcare delivery and all that. So I'm saying, how has this medical tourism, how has it affected our healthcare system in Nigeria?
It has affected our healthcare system gravely. In a very big way. Of course, that is the main thing that has hampered the development of our healthcare system. The fact that our politicians, leaders and elites can actually leave the country to treat maybe very minor ailments like ear infection at that time and all that. So it stops them from actually committing our resources to develop our health sector, because there's an alternative. But as the civil societies have been advocating for some time, that if we can actually enact a law that stops the public office holders from traveling outside for medical treatment, of course, it will make the politicians to focus on our health system. Understand? Incentivize our health professionals, give us good remuneration, upgrade the facilities, and of course, I believe we can replicate the same magic. So I think the greatest injury is to the health sector of Nigeria. And by not developing our health sector, then the commoners, the ordinary man on the street, of course, they pay the biggest price.
Yeah, they do pay the biggest price, and a lot of times, they don't even get to see another day. Probably somebody goes to the hospital and you're expecting to maybe it's just a minor surgery, you come back home, then all of a sudden your people are hearing that you're dead. And this pain is something that lives with the people. All right, so there is a lot of negative stereotypes and images high-income countries associate with developing countries. Do you think that these stereotypes and image has also greatly influenced medical tourism in the society?
Of course, it has played a big part, especially the recent WHO rating of Nigeria as number 187 out of 190 in terms of healthcare delivery. So it has played a key role, you understand, in eroding the confidence of our people in our healthcare system.
All right, so how can this confidence be built? How can we build back our confidence?
The government should do the right thing. The federal government should stop reneging on its pledge to commit at least 15% of our yearly budget to health sector development. There is a need to recruit more, medical professionals, make the profession to be attractive so that we can stop the mass exodus of our best brains to foreign countries. Then make our working conditions conducive, you understand? Provide the facilities that we need. The health insurance scheme, make it universal. Let it be more accessible to many of our people. So this trend can be put to an end.
All right, it talks about making the profession attractive, and by that I believe you're talking about the medical profession. What do you mean? How can they make this profession attractive? Attractive to look beautiful or to start shining? I don't understand.
Attractive in different ways. First of all, talk about the emolument of the health professionals. It's nothing to compare to what they are paid outside. So what our counterparts are paid outside. The working conditions, you understand? Then the residency program has to be expanded. Over the past years, we've had the same facilities. There has been a slow progress, you understand, in the teaching hospitals and tertiary teaching hospitals. So right now, it's so bad that even doctors who want to stay in the country, they cannot find spots. You understand? So if these things are done, believe me, most of my colleagues who want to leave the country to practice outside, they'll be here. Spend them all, improve the working conditions, give them more opportunities to develop themselves.
All right, okay. So in other words, you're trying to say that if better working conditions are provided for those doctors, that things will change. All right, so but what is is there some kind of grant or fund that the WHO, gives out to help the health system of every country? Because I believe that if some kind of assistance comes to us, that things might change. So is there some kind of help?
I believe Nigeria is a rich country and we do not necessarily need...
So we don't need assistance?
We don't need assistance to pay our health professionals what they deserve.
Okay.
We don't need assistance to pay them what is commensurate with what they put in. But of course, the WHO, the US government and some other developed countries, of course, they assist the country's health sector in other ways. Understand? They set up agencies that kind of cater for key diseases. Certainly the HIV/AIDS, of course, there is FHI 360 doing very good work with that, you understand? So they have their agencies through which they actually fund treatment of key diseases.
Right, like, okay, just hold that thought, and when we come back, we're going to take a short break. When we come back, I would like to know, how is this medical tourism, how is it affecting the economy of our country? Because I know there should be some kind of effect. All these millions of naira, millions of dollars that are spent in other countries that should be spent here are being given to other countries for medical care. I believe there is some kind of way it can affect us. So, but we'll be talking about that after this break. I'm going to take a short break, and when we come back, the program continues. This is still In Depth on ABS Television. You're welcome back. This is still In Depth on ABS Television. We are still talking about medical tourism. I remember just before the break, I said, when we come back, we're going to be talking about how the tourist activities in terms of medical care delivery affects the economy of Nigeria as a nation. All right, so over to you, Dr. Obida. You know, they said every action has a reaction, and every reaction has a counter reaction too. I believe that we've been talking about how is it affecting us as individuals, that's medical tourism. Why are people running away from the country? Because they're running away, people are scared, people want to leave, nobody wants to die. That is why somebody is going to spend the last card he or she has to move to another country to receive medical care. So I'm saying, how has this affected the economy? How is it affecting our economy as a nation?
Medical tourism has a very huge, it has an enormous negative impact on our economy. Because if you consider the humongous amount that we spend yearly, and it's been estimated to be over $1 billion. That's like about 360 billion naira, that's what we spend, which is even more than our yearly budget for the health sector. The budget for this year is 340 billion. So we are spending even more than we are putting in to develop our system. So you can imagine the impact that it will have on our economy if we're actually spending this money, or even half of it in our country, spending it in our own health facilities. Of course, that will help to even actually develop our health facilities, put money into the hands of, those who, work in these health facilities and, other service providers. I mean, you cannot underestimate the effect that this huge medical tourism has on the economy.
Okay, so what about manpower? Do you think we have enough skilled personnel to handle the myriad of cases that come up every day in our healthcare facility? Do you think we have enough people to handle that? Properly trained professionals, qualified professionals.
Of course, we have more than enough professionals to handle the scale of afflictions that we have to deal with.
So in other words, lack of skilled professional is not a contributory
It's not
factor.
a problem. What we need is, these guys to be encouraged. We need the government to invest, in the upgrade of facilities, provide grants for research, and even provide more opportunities. I think the problem on our hands now is that even the good professionals we have, they are leaving. If we are not well qualified, why are we being absorbed by Dubai, Saudi Arabia, US, and UK? Why are we, They are accepting our medical professionals in droves, So if we are not good, why are, and our people are doing very well over there. So the problem is not in the number or maybe the competence of the professionals. It's just the enabling environment for them to excel.
Right, so it's the environment.
Yes.
And so how can this environment, what can be done to help the environment for them to change?
Goes
The
back to
government still.
goes back to the
So
government.
you're saying that the entirety of all this blame and of all this talk rests on the shoulders of the government.
Yes.
So are you
unfortunately.
saying that the medical practitioners themselves don't have any role to play in ensuring that medical tourism is reduced? I mean,
I believe the medical professionals are willing to work. They were willing to stay back. But are you going to stay back and face hardship? You understand? Are you going to stay back when you cannot even take care of your basic necessities? Some of the state teaching hospitals, they pay their doctors very poor salary. And then once you're a doctor, I mean, their expectation from your family and the society is huge. So some of them cannot really meet up with the expectations. Then some of them cannot even find places. Even today, to find a spot for internship, something as little as internship, it's a hassle. Some people end up waiting for 2 years. So I think the government has to do most of the work.
all right, okay. So Dr. Obinna Aniabosa, what are your final thoughts on medical tourism and how it affects our society? Your final thoughts?
Medical tourism it's a huge problem for the nation, and it has to be tackled if our health sector is to advance. So I'm calling on the government, the legislatures, to enact that law that stops public office holders from leaving the shores of this country to access medical care. If that is done, I believe that they will be fully committed to the development of our health sector.
All right, thank you very much, Doctor. And we'll be speaking with Dr. Obinna Aniabosa. He's the President, Association of Resident Doctors of Chukwuemeka Odumegwu Ojukwu University Teaching Hospital, Amako, Oka. Yes, he came here to talk to us today on medical tourism. How does it affect us as a nation? How is it causing a brain drain in the health sector? Thank you, Doc, for coming to the program.
Thanks for having me.
All right, well, there you have it. Our development rests entirely on our shoulder. Running away from our country to receive healthcare services in other countries is not the solution to our problem. On the other hand, the quality of healthcare delivery in our country, Nigeria, should be improved, because I believe that when people are encouraged and when people are sure that are going to receive the best possible care, there won't be any need for them to run to other countries to receive healthcare delivery. We have everything it takes to make us not just great, but even make us a country where people can come and receive healthcare, very good healthcare services. So, we should believe in our country, invest in our healthcare system, and discourage all those tourist activities going on in other countries. My name is Priska Wangwo. Till next time on INDEPTH. This is ABS Television. Bye for now.